Like DOGE and Elon Musk, or perhaps not Elon Musk, because since he's talking about leaving DOGE here pretty soon, but he said he's going to still stay involved in all thing DOGE. They said they want to go ahead and have access to pretty much everything. So we're going to talk about that today. So my name is Ed Weir, and I ran the third business Social Security office in the country. If you're new to my channel, this is also a live Q&A. Also, it looks like we already got a bunch of questions up there for all things Social Security, retirement, survivor benefits, disability benefits. You got any questions? Make sure you type it in the chat, and I'll answer as many as I can here. Today is going to be a little bit shorter, about 30 minutes or so for the live Q&A. Usually I do about an hour, but this is the second one today. And I wanted to talk about the attempt to get into your Social Security records. Okay, so the judge basically said that, okay, you want access, full access to all Social Security data. And Social Security records, they have pretty much everything. They have all your earnings throughout your life. They have who you're married to, when you were divorced, who your kids are, how much they made, their dates of birth. If you're on, if you ever file for disability benefits, then they have all your medical records, your prescriptions, what type of prescriptions you take, what doctors you go to, what you go to those doctors for. Social Security has everything, and they've always kind of siloed that information. It's like if other agencies want it, basically tough. If the person doesn't specifically, if you don't specifically say, hey, Social Security, send this to the VA or do something like this, then Social Security doesn't do it. In terms of audits, so the judge is saying, okay, Elon Musk and DOGE, you want to go in there and check out all the records for fraud, waste, and abuse. Beautiful. Okay, perfect. Social Security does that on a regular basis. In my office and all offices throughout the country, private accounting firms that know kind of what they're doing, Ernst & Young and different companies, come into Social Security and they audit those records to make sure everything is done correctly. And guess what? Social Security has passed 31 out of the last audits, not so much with the Department of Defense, but Social Security has always passed those audits. My office, we always passed on flying colors, but there's certain things that have to be limited. The people that have access to those records, like for me, having access as a Social Security employee, an old now retired, but had to go through the FBI background check and all that kind of stuff. Same type of thing with Ernst & Young or any other companies like that. They have to go through background checks to get access to the federal buildings and to get access to the records. And even then, when these people, for instance, they came into my office, they always, they didn't get the information of the particular person. They just use it as, client A, client B, client C, client D, or something like that. And then in those particular, so they didn't get the personal information, the Social Security number, the date of birth and stuff like that. They just look at it and they didn't know whose record they're looking at. They just look at the record. They're not allowed to connect the two. So they do audits like that. And they've been doing audits like that for decades. But so that's how it's actually supposed to be done, because it's not their, it's not their business. You didn't provide that organization, that private organization, access to all of your medical records with your names on it. They're there to audit, but they're not there to, do essentially a fishing expedition, which this judge basically said DOGE is doing a fishing expedition. And one of the reasons I would argue that they're also doing a fishing expedition is because they don't know really what they're doing. It's kind of obvious. If it's not obvious to you, then unfortunately, you haven't been watching my channel. They don't know what they're doing. Number one, they went in there and they said, there's 20 million people over 120 years old that are receiving Social Security benefits. And you notice they haven't found one dime of money going to those people over 120 years old, because as I said, when they first came out with that misinformation, they don't know what they're looking at. And it's proven that they don't know where they're looking at, because they haven't found one penny, because the records they are looking at, there's no money there. They are looking at the numident. The money is issued out of the MBR. I give it as this kind of an example. Say you go to a restaurant and you have a bill, you go up to the cashier and they've got the little slot there where you push your credit card in. Next time, When they tell you to put your credit card in the slot, pull out your driver's license. Try your driver's license. That's basically what DOGE was doing. They were trying to put their driver's license in the little credit card slot. That's how much they know about Social Security. So, and the overpayment thing, they said, okay, we're going to hold back 10% of overpayments. We're going to hold back 100% of overpayments. They just changed it a few days now. Now we're going to hold back 50% of overpayments. We're going to make everybody go down to the local Social Security office. Okay, we're going to only make these people go down to the local Social Security office to prove this, that, and the other. Oh, okay, we're not going to make people do this anymore because of this, that, and the other. So they really need someone on their team that knows what they're doing. And people will say, Ed, why don't you volunteer? I have volunteered several times, and they have no interest in getting people that actually know what they're doing, because perhaps they're not really looking for fraud, waste, and abuse. If they actually were, they would have found some by now. But I don't think they're interested in actually finding fraud, waste, and abuse. They have perhaps some other ulterior motives that I'm sure you can figure out for yourself. But if they were looking for fraud, waste, and abuse, is there fraud, waste, and abuse at Social Security? Absolutely. People are receiving disability benefits that are still working. People are receiving disability benefits that are not disabled. People are receiving SSI that have other income and resources. But that's not the kind of the small type of thing they're looking at. They're looking, for 20 million, zombies receiving Social Security benefits, and 1.3 million non-citizens receiving Medicaid. Or they actually changed it the next day and they said they're receiving Medicare. And then they said, no, Medicaid. They don't know the difference between Medicaid and Medicare. So they really need someone on their team. So if, Elon Musk, any of these guys want to contact me, and I can teach them, watch my videos, and they can, learn about Social Security before they go in there. So I think that's kind of the judge's intent is, hey, number one, y'all need to know what you're doing before you go in there. Number two, do you really need to, all of the details of these particular individuals? Do you actually need their names and Social Security number? If you're actually looking for fraud, waste, and abuse, you don't really need that information. You can look at fraud, waste, and abuse without connecting to particular people until you are going to be arresting those people. And then when you arrest those people, then you can work with law enforcement, Office of the Inspector General, FBI, or whatever the case may be. But until then, it's a fishing expedition. There is another thing that's happened. I'll get into the Q&A here in a bit, but there's another thing that happened, the Freedom of Information Act. So DOGE and Elon Musk said, hey, we're the most transparent thing that's ever happened, but they're saying you're not allowed to oversee us. You're not allowed to look at our records. So there's a lot of people, a lot of organizations that requested from DOGE, hey, we want information of what y'all been doing in Social Security, Department of Labor, whatever the IRS. We want information. What the heck have y'all been doing in there? And DOGE and Elon Musk says, well, no, you can't get that information. Like every other organization, governmental organization, you have a Freedom of Information Act. And the judge says, no, you have to give that information. So they're fighting that now. So we'll see what happens with that going forward. Okay, so I just wanted to jump in here and give some updates on those things. So let's make sure we watch what's going on. If you don't want your private information to be turned over to Elon Musk and DOGE, then you need to reach out to your politicians and definitely let them know. And thank you for Bella for mentioning the DOGE Freedom of Information Act. That's why I went ahead and put it up there. I appreciate that. All right. Kathy says, why do they want this information? What do they plan to do with it? Why is he not being stopped? Yes. I mean, again, fraud, waste, and abuse, Social Security employees, the Office of Inspector General find fraud, waste, and abuse on a daily, weekly basis. All you have to do is Google in your state, local woman, local man, Social Security fraud, and you'll find something within the last few months of Social Security people finding someone that's defrauding the system. But DOGE and Elon Musk have found zero. If you have found an actual story of DOGE and Elon Musk actually finding fraud at Social Security, make sure you put it in the chat or the description if you're watching this on a recording later. But just don't say an allegation. They say this, that, and the other. I mean, an actual case where they found fraud, waste, and abuse. Because it's easy to find, but they're not looking for it. So They'll get everyone's info, legislators, wealthy, everyone's, wonder what came of it, where the Department of Labor files immediately sent to a Russian. Yeah, that's been kind of reported there. So we'll see what's. I think the Government Accountability Office, which is another agency that actually finds fraud, waste, and abuse, and they find fraud, waste, and abuse all the time. The Government Accountability Office is doing a review of what DOGE has done at the Department of Labor. I'm not sure why they didn't start with the Social Security Administration. They should really, really look and see what's going on there. Um, and for those out there that say I'm just a hater on DOGE and Elon Musk or whatever, if you go back to my videos when they first started out, I said, hey, there's great potential for the computer system needs to be updated. Social Security has been begging Congress for decades to let them update the computer system, and Congress has always said no. There's always been a great need for stuff like this, but why aren't they doing it? Why are they talking about completely irrelevant stuff that means nothing? Can anyone answer this? Is it mandatory to create an account with login in order to receive your monthly Social Security check? No, it is not. Thank you for bringing that up. There's a lot of social media land BS out there about this clickbait type stuff where it's just, some article. There's a couple of news websites out of Spain that talk about this stuff all the time. They take advantage of, people, and they run these BS stories. No, what it is if you want to get in to your Social Security account, My Social Security through SSA.gov, if you want to go in there and get that, then you have to set up a login account. If you set up an account like 5 or 10 years ago, that doesn't matter. The new system that came out within the last year or so, you had to upgrade to the new system. And if you don't upgrade to the new system, then you just can't get online and do stuff online. But if you don't want to do stuff online, then you don't have to set up an account, and it's not going to affect anything whatsoever. So those organizations and social media people out there doing stories like that, please stop. You're freaking people out. So we must have the right to privacy. Yes. How are they legally allowed to get this information? Isn't there HIPAA laws that make it this illegal? Yeah, you can't get that information. And again, when these private companies, these accounting firms that sent people in, and these guys knew what they're talking about. So the people that always came to my office, again, we always pass with flying colors. Although every now and then we get dinged on a couple of things. I have one of their claim specialists that having a husband and wife there. And one of the things we got dinged on was the attestation. Do you agree that this information is true and correct to the best of your knowledge? Yada, yada, yada. And they read it to the husband, but they needed to read it to the wife a second time, even though they were both listening at the same time. And the Ernst & Young said, you're supposed to read that statement both, even though, yes, they understand you had to read it both 2 times. So that's what we got dinged on. So other than that, everything was flying colors. So but yeah, and these guys know what they're talking about when they came in. So it's easy to track you with this info. Also, they make money selling people's info. Yes, I mean that's the thing of the future, isn't it? People with information, and particularly an ability to process all of that new information that they have on everybody's lives based on artificial intelligence. If you've got hundreds of millions of records, it's kind of like a crapshoot, whether you're going to get messed with. But now that they've got AI, so much more. Yeah. Let me see. After receiving Social Security for the past 7 years, my last check was reduced by about $200. Any idea why? By about $200. That sounds like a Part B. Medicare Part B type of issue. Medicare Part B is $185. I'm just kind of guesstimating here based on your question. So $200 sounds like a Part B type thing. Possibly you were receiving Medicaid from your particular state, and this is what's called the Medicare Savings Program. If you or anybody out there is having difficult paying the $185 Part B, tell them to reach out to your state Medicaid office and apply for Medicaid. And then the state just might pay for your Part B. So it sounds like in this case, the state was paying for your Part B premium, and now they're not. So you've lost Medicaid, or you've lost that level of Medicaid. There's several different levels of Medicaid. So you might have lost that Medicaid, that level, and therefore they're not paying for your $185. So I would check that out. If you did, and you also have a Medicare Advantage dual eligible plan, then you're also going to lose that dual eligible plan, and you need to find something else. So you can reach out to Chapter there. They can help you 100% for free to see if there's anything in there. And they can also check to see if your $185 is being paid. So I'm Joseph. I'm letting everyone know that my second cousin passed away this morning. Okay. Sorry to hear that. Let's see. I worked for cities, college district, and nonprofits. Will I receive more money? It depends. So you sound like you're talking about the Social Security Fairness Act. If that's a non-covered entity that you did not pay into Social Security when you work for those places, then you just might. So let's see. Why is it that they want access to your Social Security? That's evasion of privacy, but why? Yeah. Again, yeah, I mean, they can't have access, but they just, have access just to look for fraud, waste, and abuse. And they don't need particular names and Social Security numbers to do that. They just need to look for fraud, waste, and abuse. Not sure why they need the actual names. If they find a record here of someone that's, fraud, waste, and abuse, then they can say, hey, this looks like client A is not receiving benefits like they're supposed to. So we need to report this to the Office of Inspector General and of Social Security, which all Social Security offices, we used to have our Inspector General, a local office. Hey, Mike, come to our office on a regular basis and say, hey, you got anything for us? Oh, yeah. I think, Vicky over there has found something. So, so Mike would go over there and talk to Vicky, and what you got? Oh, we've got this person that looks like they've got this fake, whatever. And then they would start an investigation. So why on God's green earth are you not in favor of waste, fraud, and abuse? The number of SSD scams. That's what I just talked about, right? But yes. So, yes. Hubby starts collecting June 1st, start in July. My amount is less than half of what his would be monthly. Will I get his because it's higher amount even though I'm 62? Okay, so if your full benefit amount is less than half of his full benefit amount, then yeah, you could be eligible for benefits on his record. Remember, you have to file for benefits on your own record. So you file for benefits on your own record, and then you can file for benefits on his record once he starts those benefits. Yes. So you'll get your own benefit. It'll be reduced because you're 62. And then your spouse benefits are going to be reduced because you're 62. You're filing those early. But for spouse benefits, you can get up to 50%, but it's reduced because you're filing early. And guess what? On my new website that I'm working on, it's getting close to being done. I've actually got a calculator that's working out really, really good. So it'll give you all the details on that. Been finding a lot of corruption, government dipping into our money is why. Okay, but not with Social Security. So, and getting rid of all those Social Security employees is just making it more difficult for people out there to access their benefits. So, this is unacceptable. Can we go into their accounts and see what they have in their bank accounts? It's also a bunch of mess, so they can take our money. Yeah, I don't think they're going to let us have access to their accounts. Crystal Phillips, unacceptable. Are you old military? You married to old military? Unsatisfactory, unacceptable. Yes. If you don't have anything at all to hide, shouldn't be a problem. They need access to finish cleaning out all the fraud from all the different levels of government. Permission granted. All right. Well, then you give permission to access all your records, but a lot of other people not so much. So again, they don't need the personal identifying number information to look for fraud, waste, and abuse. That's the whole issue. If they're given access and background checks, these people have to be given background checks. Again, so DOGE, if you need help, you want to understand what the system is. It's obviously you don't have anybody on your team that knows about Social Security. Call me up. I'd be more than happy. I've already done my background investigation and all that kind of stuff, and I can show you where you can find it. And but why they haven't, riddle me that. is if Social Security has always done as you say, then why haven't they found all the fraud? No, Social Security has not done their job correctly. You tell half truth. No, if you look at the audits, Social Security incorrect payments are less than 1%, which is pretty awesome considering, $1.3 trillion goes out. Can they do better? Can Social Security do better? Of course they can. All agents. So that's why I say DOGE, if wanted to go in there and actually look for fraud, waste, and abuse, they could help. But why haven't they? Yeah, why? I mean, my office, we found hundreds of millions of dollars of fraud, waste, and abuse. So yeah, not sure. I mean, I could, yeah. Anyway, why? Why? I will be 65 in June. Early retirement at 62. Still work. Apply for Medicare A and B. Get my health insurance from formal job. I plan to apply for Social Security at 67. Is there any penalty? Okay, so so you still work, but you receive health insurance from a former job. I'm not sure. I'm reading. You said forma, so I'm not sure what forma is. Okay, let's say you have health insurance from current work, and your employer has 20 or more employees. Then you do not need to do anything. Well, because you're already receiving Social Security benefits, you do, because you're going to be signed up for Medicare automatically, and it's May, and you're going to be 65 in June. If you haven't, you should have already received your Medicare packet in the mail, and you haven't. Therefore, doesn't sound like you're receiving Social Security retirement benefits, or unless the packet is lost in the mail somewhere. But if you have health insurance from current work and you're happy with it and the employer has 20 or more employees, then you do not have to sign up for Part A or Part B. If you're currently receiving Social Security benefits, then you have to sign up for Part A, but you can refuse Part B. And then when you stop working in the future, you can go ahead and sign up for Part B, and there's no penalty whatsoever. So let's see here. No, they don't want or need that information. They found a lot of fraud, waste, and abuse, a lot of fake organizations too. Okay. Yeah. Again, they haven't found anything at Social Security. So, again, they went in there with all kinds of, incorrect information, and which is fine. If you hear about, 20 million people over 120 years old, then yeah, you would say something. But then you go in there and ask a Social Security employee, okay, what is the story on this? Oh, that's the pneumodent. Social Security can't close out until Congress says until they get a death certificate. And these people, missing in action, or they passed away overseas, so we can't get a death certificate. And these people aren't getting any money, so why waste taxpayers' money on addressing that? They're not getting money, so anyway. They need to be shut down and stopped immediately. That is private information, and I do not authorize them to look into my history. Okay, so there you go. Ed, you're right. They don't want to hire people who ate smart and know how to help people. It's sickening. Yeah, to eat smart. That's definitely not me. I should stay away from junk food. Anyway, so there's that. Democrats are the one with their heads exploding, and they are the ones that release the most information anywhere. Just stupid and BS. Okay, yeah. So, Steve Ram says they're working on the DOGE check. Yeah, that's not going to happen. So the idea for the DOGE check was just some social media person and say, hey, if y'all find trillions of dollars of money and savings, why don't y'all give that some back? And they're, oh, okay. How about 20% we give back to the Americans? 20% we give back to debt, and the other we give to tax cuts for the rich. 60%. So we got kind of screwed there. And Elon Musk said, oh, that's a good idea. That's it. So yeah, there's not going to be any DOGE dividend check. Yeah, no. If you need to block some, oh, okay, here we go. Someone is in here is causing trouble. Okay, every function will be monitored. This has to be stopped. If I proved who I am when I got my Social Security, that should be enough. I think they want to weaponize this against the Trump enemies. Yeah. Let's see here. Let's see if we can get a question helps someone get their benefits. Dr. Weir, important. Check out the new terms of service to be able to access Social Security online. It is scary beyond belief. All right. Yeah, I'm gonna have to definitely check that. But the new system that they've come up, this is the new ID me and all that kind of stuff. It's not a DOGE system. It's been on the works for a while, since what, last year, a couple of years ago now, that you have to go in there and show your ID and all that stuff to get online. I think it's a great system. It's a nightmare to get in. But that's good because it protects your information and it makes it more difficult for someone to go in there and pretend to be you. So, all right, got another question here. Medicaid needs to be the same across the board instead of separating into different state programs. Yeah, Medicaid is different. So you've got Medicare. So Elon Musk and DOGE, please listen to this since y'all don't know the difference. Medicare is the one you sign up with the Social Security Administration. Part A and Part B, and then the prescription drug plans and the supplements and stuff like that. Part A covers hospitals. Part B covers the doctors. Medicaid is a state administered program, but it is funded with federal money. So there are certain guardrails, certain things that the federal government says has to be part of Medicaid. And some states call it different, Medi-Cal and Badger Care and Apple Care and all kinds of different names, but it's all Medicaid. But states have a limited amount of latitude to do Medicaid a little bit differently. Like I had a person who was living in one state and they were receiving Medicaid. They were eligible for Medicaid. They moved to another state and they lost their Medicaid because in the state they were living, in terms of income, they did not count their disability benefits. When they moved to another state, that state did count their Social Security disability benefits. So I guess that's a states' rights but it makes everything far more difficult. I agree. Christine, Heather, what are you? Okay, do they? Okay, talk about the. Could it be worse than the I? Was it the old? The Apple terms of service, 40 pages or something. Okay, I already answered that one. What government agencies should we contact to protect our information from DOGE? Your politicians. Contact your politicians and say, no, this is not, this is not right. There are organizations looking for fraud, waste, and abuse. Social Security employees, they look for fraud, waste, and abuse on a daily basis. They report it to the Office of Inspector General. There's the government accountability offices. Those were, DOGE before there was DOGE. So, why does this other organization, again, if they're actually looking for fraud, waste, and abuse, then after they go back through their background checks, the FBI, and once they learn what they're doing, then more power to them. But until then, a lot of us don't agree that they should be doing stuff like that. I think everyone wants efficiency. Yep, I agree. But Elon Musk has said too many negative things about Social Security, and it seems like they're spending too much time on Social Security. It makes seem like an attack. Yeah, they came in and said, Social Security is a giant Ponzi scheme. It is the greatest fraud in history, and if you go in there with that intent that you think it's illegal, then yeah. So Semper Fi, thanks for all you do. Keep up the good work. You're welcome. Hoorah, Semper Fi. Is that why I keep getting all these annoying spam calls? No, that's probably different. That's probably Medicare type stuff. And I'm going to do a video here pretty soon about how to try to stop those annoying Medicare calls. And there's actually some of those companies have been sued. I'm going to do a video on that in the next couple of days on these companies, these Medicare insurance companies, these big companies that have been directing people in Medicare plans that are not for them and calling people when they're not supposed to. Basically, Medicare, those sales calls, Medicare sales are highly, highly regulated. So the example I always give is if you go into, like a Walmart or Target or whatever the case, your local drugstore, and you see a table, someone set up there with a table, and there's a guy or girl sitting there, and they've got the button that says, ask me about Medicare, and they've got a little sign there, and they're just sitting there staring at the ceiling. And you're like, wow, that person's a terrible salesperson. They should get up and talk to people. Well, they're not allowed to. They cannot say anything to you basically until you reach out to. That's why the sign says, ask me about Medicare, because they're like, as soon as you say, hey, what about Medicare? Then they're going to jump up. Oh yeah, let me tell you about this and this plan, yada, yada, yada. Until then, they can't do it. So same type of thing on the phone. If you tell someone to call you and because you want to talk to them about Medicare, they can call you. Them or their company can call you. But if they call you and you say, oh, okay, no, I'm not interested. What is happening now, which is they're not supposed to do, they're selling your information to other, Medicare insurance people, and they're calling you. They're not supposed to do that. So I got tired of that. That's why I reached out to Chapter, and they don't do that BS. So if you need help, just reach out to Chapter and they'll help you out. Even if you tell me, like we've got someone like Kathy says, hey, Kathy says, hey, Ed, tell Chapter to call me. Can't do it. Yeah. I can't. If I called Chapter and I said, hey, Kathy told me to tell you to call her. Here's her phone number. Chapter would say, no, Ed, come on, Ed. I can't do that. We can't do that. Kathy has to call Chapter directly. You have to reach out to Chapter, and that's the only way they'll talk to you. So that's the way it should be done. All these other calls and stuff, it shouldn't happen like that. Yeah, it's unfortunate. People are getting dozens and dozens of calls every day. It's unsatisfactory. It's unsat. Christina, I'm not on Medicare. I'm only 64. I'm a resident of Florida, and my Medicaid in Florida was cut 2 months ago. Ron DeSantis and his wife stole Medicaid fund during 2024. Yeah, so that's probably where that $200, unfortunately. So you've lost Medicaid. So if you have a Medicare Advantage dual eligible plan, I always recommend Medicare supplement plans, Plan N or G. But if you have Medicaid, then all you can get is a Medicare Advantage plan if you want one on Medicaid. And then you get a Medicare Advantage dual eligible plan. So now you're in your special enrollment period, or not in your, you have a special enrollment period because you lost Medicaid. You really need to switch from that dual eligible plan, if that's what you had, into a regular plan, because your Medicare, your dual eligible plan was canceled when you lost Medicaid, or it will be canceled soon. They give you some type of kind of breathing room there, but you can reach out to Medicare or reach out to Chapter there, or whoever you trust to sign you up and check to see what's going on. So, but if you lost Medicaid and you don't agree that you should have lost Medicaid, make sure you appeal. If they say, well, you lost Medicaid because you had this much of savings or earnings that put you over. And if you say, no, I didn't, then make sure you reach out there. All right, let's see here. Millie Martinez, already collecting Social Security, turning 65 in September. How do I apply for Part B? You do nothing because you're already collecting Social Security. About 3 months before you turn 65, they will sign you up for Medicare automatically. You will be signed up for Part A and Part B automatically. So about 3 months before you turn 65, you'll get your Medicare packet in the mail with the Medicare card A and B and all that kind of stuff. And if you want to keep it, then you keep it. If you don't, then you can refuse Part B if you have creditable coverage. But a couple of months before that, I would start figuring out what you're going to do to cover all the gaps of original Medicare. The Part B has a 20% coinsurance that you have to pay everything. You have to pay 20% of everything, doctors wise. So that's why people get either a Medicare supplement plan to cover those gaps or a Medicare Advantage plan. I always, anytime you reach out to anybody, Chapter or whoever, I don't care, always say, hey, I'm going to get my A and B here pretty soon in a month or two. Tell me about Medicare supplement plans. Start with that. And then what's the difference between an N and a G plan? Okay, now that you told me that, what's the difference between a Medicare supplement and a Medicare Advantage plan? Tell me about a Medicare Advantage plan. And that way you have all the information, and whatever you choose, whatever is best for you, then at least you know that you've got all the information. That's why those companies, those big Medicare insurance companies, are being sued right now, is because they were directing people into Medicare Advantage because there was more money in there for them. So they weren't telling them about Medicare supplement plans because everybody makes less money on those Medicare supplement plans, brokers, insurance companies. So they were directing them, steering them to Medicare Advantage plans so they make more money. And it's not the benefit of you, it was the benefit of them. So I'm glad. That's why my son and I reached out to Chapter, last year and said, hey, we're tired of these. We need someone that, people can go to that they can trust. So let's see. President Musk will get all of our records so the government can move on us whenever they want, and he can sell you all whatever he wants. Yeah. Brenda, I am divorced over 10 years of marriage and disabled. Ex is over 62. Can I get more, or do I have to wait until I'm 65 too, or not all like I was told? Okay. So you were divorced. You're married for 10 years, so you're good there. You're disabled. So is disabled X is, and okay. And disabled. Okay. All right. Not sure how old you are right now. You said you're going to be waiting until 65, but if you are at least 62 years old, then you can file for benefits on your ex's record because he is at least 62 years old. But so that's not going to affect your disability. You're on disability benefits. Oh, wait, or you're on disability benefit, or he's on disability. Anyway, but you have to file for benefits on your own record. And then if his benefit amount is twice your full benefit amount, then you're entitled to up to 50%. So you could very well be. So, you don't know, how much his is and all that kind of good stuff. So I'd reach out to call Social Security, be on the phone for 3 hours, and give them your ex's information. If you don't know the Social Security number, no problem. Just tell them that person's name, their date of birth as well as you remember it, where the city and state they were born, and the Social Security employee will be able to find that person, and they can look to see how much that benefit amount is and how much your benefit amount is, and they'll tell you whether there's more money there. And if there's more money there, they'll set you up an appointment so you can get that their money. So, will I need to do this even with veteran health care? Veteran health care. If we're talking about veteran health care in terms of you are actually retired, like I'm a veteran, but I don't receive, it's called TRICARE for life. I didn't do 20 years. I only did 8 years in the Marine Corps, which is 20 years in all other services, but we won't go there. Right. So if you actually retired, you got TRICARE for life, then you get TRICARE for life, you get Medicare Part A and Part B, and that's it. You're done. Don't let anybody tell you, call Chapter and they'll tell you the same thing. There's other people out there that try to sell you the Medicare Advantage and supplement and all that. You don't really need all that. You're good. But if you are a veteran and you're not getting TRICARE for life, then I would recommend something, because particularly what's going on with the Veterans Administration, they're losing all those staff, and you might be completely happy with, your VA clinic now. And you're saying, well, I'm happy, and so I get all my stuff through them. So I don't want to have to pay Part B, the $185. But what happens a year from now, 5 years from now, 10 years from now, when that VA health clinic closes, or, the service goes downhill, or you need a second opinion or something, and you don't have Medicare? If you sign up for it, then you're going to get penalized for every 12 months you didn't have it. So there's ways to get around it. If you're really low income, then you can file for Medicaid and get Medicaid, and they can pay for your $185. But there's also called Medicare Part B give back plans. So you sign up for Part A, Part B, get a Medicare Advantage Part B give back plan, and they pay for your part of your Part B. That's why they call it Medicare Advantage Part B give back plans. So they pay $50, $100, all of it depends what's available in your particular area. And so you can have your kind of cake and eat it too. That way you've got a fallback position there in case the VA clinic goes south. And a lot of those plans, they're called Patriot plans, or honor plans, because veterans use those, and they don't come with prescription drug in there because the Veterans Administration still has the best prescription drug plan because they're able to negotiate prices. Go figure. So Let me see here. George Orwell's 1984 predicted this, but not private biz having our info. Yeah, I would argue it's more of Huxley's Brave New World. So, but you can read a book by Neil Postman, Amusing Ourselves to Death. Read the first couple of chapters, and it does a great comparison between 1984 and Brave New World. Yeah. The centrifugal bumble puppy, which is always the best phrase. And yeah. Social Security audit nothing burger. Tell me how then so many fake Social Securities are into the system and you don't know about, or you know and just close your eyes there in your office. Fake Social Security numbers are into the system. Yeah, not exactly sure what you're talking about. They're fake Social Security numbers. Yeah, they're not in the. There are people, and maybe you're talking about people that work illegally under someone else's Social Security number, and there's the employers are supposed to check that out. When an employer hires someone, there is a Social Security system that they can go in there and confirm that that Social Security number belongs to that particular person. But employers don't want to do that because they want to hire this person that's actually not supposed to be working and fire the person that's, anyway, because they want to save money. So they want to pay this guy $10 an hour instead of this person, $20 an hour. So they turn their head, and so they don't go through the system that they should. And so that person pays taxes, pays Social Security, and it's estimated that in terms of Social Security, they pay $37 billion a year into Social Security. So it's actually good for us. It's actually a donation. If you're receiving Social Security, you should say thank you. Thank you for the donation to the trust fund. So they donate billions of dollars every year into the Social Security trust fund, and they would never get it back because they don't have legal status in the United States. So if you want that to stop, then the employers, what they need to do is make it mandatory for the employers, the people that actually employ these people, to check the system to make sure that Social Security number is actually theirs. And if they don't, then we should start throwing some of those employers in jail and the people that, provided those. So yes, I agree with you in that case. But yeah. Anyone having trouble downloading their Social Security docs today? Link doesn't work. Oh, yeah, I've heard that several times. On the weekends and stuff, there, it's regular maintenance for the My Social Security account and stuff. So I'm not going to blame DOGE on that. They do regular maintenance. It's usually a late on, weekends and stuff like that. So, but the Social Security system has gone down more than usual over the last couple of months. That is 100% a fact. But on what's going on right now, it's nobody can, you'd have to know what's going on the inside. So I'm not going to, cast aspersions if I don't know 100% for sure. Actually, yes, government dipping into our Social Security to give benefits like Medicare and Medicaid to illegal. No, that is 100% incorrect. In order to get processed for Social Security or Medicare, then Melody, you obviously were fraudulently working for the Social Security Administration, doing things wrong, because you had to do things really, really wrong. Because Melody, if you know about this, if you work at Social Security, which obviously you don't, when you adjudicate a claim through MCS, in the path that you have to include the citizenship of the person or the alien number of that person if they're in the country legally, and then you have to go through the SAVE system. Obviously, you know this because you're speaking through authority here. So you have to go through the SAVE system, and if you don't do that, you can't go into the next screen. It's like, you fill out a form online or something, and it says, you fill in your name and address, and you don't include your zip code or something, and it comes a little red line. You can't click submit button until you put in, this thing. That's the same thing for Social Security systems. Until you put in the person's legal status in the United States, it redlines. You can't go to the next page. And if you can't go to the next page in MCS, you cannot adjudicate that claim. So sorry, not sure what office you worked in, which obviously you didn't, but yes, anyway, there's that. All right, we are getting close. Let me get a couple of more questions. on Social Security type stuff. Lana, I turned 65 in 2 months, but I've been on SSD for 10 years. Will I be switched to regular Social Security without having to do anything or change anything about my Medicare? Okay, good questions. In terms of Social Security, the actual money benefits, no, you don't have to do anything. That will switch from regular disability benefits to regular retirement benefits once you hit your full retirement age. The check amount, everything will stay the same, but there's no more CDRs, no more work limitations. So your money amount, nothing. Medicare, if you're going to be 65 in 2 months, you are at a special window that you have now because you're turning 65. In your state, probably the only thing you could have signed up for in terms of a Medicare plan is a Medicare Advantage plan, because most states don't allow people under 65 to get Medicare supplement plans, the ones I always recommend. But again, I always say recommend, but it's, everybody's different. So it depends on your budget and everything. So having either one of those, a Medicare supplement, Medicare Advantage, one of those is far better than having nothing. So you got to have something, either a Medicare supplement or Medicare Advantage or Medicaid or TRICARE for life. But anyway, but now that you're turning 65, nobody can refuse you. Nobody can charge you extra for a Medicare supplement. So what I would do, whoever you know and trust that helps you out with Medicare, call up chapter, whoever, and say, hey, I've been on disability and the only thing I could get was a Medicare Advantage plan. Tell me about Medicare supplement plans. Why are those better? Or are they better for me, and all the rest of it? And if nothing else, you'll be informed and you'll know your options. And if your Medicare Advantage plan is still the best for you because of budget or whatever, then more power to you. Then you just go on with your life. But at least this is the one opportunity really that they can't deny you on a Medicare supplement. So just call up whoever and say, hey, tell me about Medicare supplement plan N and G. So, all right. Let's see. Let me see if anybody responded to some of my, so that way we give people fair, response. Oh, someone, Prissy Monster, is it common to receive it? Oh, it's supported me, $10. Thank you. My son and I do appreciate it. Is it common to receive an SSI denial on site versus SSDI decision make, but will be mailed? Why not indicated approval or denied? Good question. Yeah, this is the Social Security employee should have told you this. When you apply for disability benefits, Social Security employees are supposed to address both programs. What does that mean? There's two disability programs. There's SSI and SSDI. So they always address both, and they have to close out the SSI issue, which basically means, hey, you're applying for disability. Okay, we take the application, get all your, medical information, yada, 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 yada. And then they also see if you're eligible for SSI, which is the welfare-based program, low income, low resources. So if it turns out like your SSDI is going to be, over $967, then they just deny your SSI. If they ask you if you got resources over $2,000 or $3,000, they deny your SSI. If they find out you've got, you're married and your spouse works, they deny you for SSI. So you'll receive that letter that says you're denied. And on the top of it, it'll say for supplemental security income. So that's just the SSI part. So don't worry about that. The Social Security employee should have told you that said, hey, you'll receive this letter and it's just for the SSI part. Your SSDI stuff, they're hopefully continuing to work on that. So what I would do is if they are continuing to work on your SSDI, everything was good there, then they put that all together. They send it to the state agency called DDS, Disability Determination Services. And what I would then, it's out of the local office. It's now in the state agency. So in a few weeks, once they forward it up there, I would call the state DDS. You can just Google, state Social Security Disability Determination Services, and say, hey, who's the claim examiner that has my case? And they'll connect you with the person that's working your case. And that way, number one, you can make sure it got up there. And number two, you can say, hey, it's me, Prissy Monster. Just want to say hi. Just want to make sure you got it. This is my phone number. If you need anything else, just let me know. And that way you're kind of keeping an eye on it. So, all right, that is it for today. I appreciate y'all, and please take care of each other, and we'll see y'all tomorrow. Bye bye.